All right, we're ready, Brian? We're ready. All right, good evening. Welcome to the first of four community follow-up sessions regarding our Mental Health Service Act 3-year planning process. Tonight, I'm Ahmad Brahmi. I'm Division Manager here at Fresno County Department of Behavioral Health, and our team was tasked with overseeing the development of the new MHSA 3-year plan, which included a lot of community engagement, stakeholder forums, surveys, a lot of things to be able to develop that plan in accordance with the regulations regarding MHSA 3-year planning. What I'm going to do is give you guys just a quick overview of the reason why we're here this evening. When we started these community planning process last November, actually, had promised to come back to our stakeholders once we finished that process and report back, sharing with you what we heard, what was going to go into the plan, some of our rationale for decisions we were making before the plan would be posted for 30-day public comment and be able to be moving forward. A lot of times we hear things from stakeholders, but some of their they may feel like their input was not included in a plan because a particular idea or something they mentioned they may have not seen. And so we wanted to make sure that we just share a little bit back and have that really dialogue with our community members. In our community planning process, we did not go over some of the existing programs. So there may have been ideas for services or programs that people may have shared with us that were already existing, or there may have been things in the works, and we wanted that community process to be really the sharing of ideas and allowing our community to speak. So we didn't really guide or direct people, say, well, we already have that program. We heard it all. So this is our chance to really let you know what we heard, that we heard you, what we heard, and what we're trying to do. But also provide you guys with a bit of input on really how COVID-19 has impacted that process. Like I said, we started this process a year ago. We were hoping to have these meetings in the spring and have the plan approved before the end of the fiscal year. However, the impact of COVID-19, when it came about, delayed those, the shelter-in-place orders. We were focusing our attention to a lot of other supports throughout the county, as well as wanting to see what was going to be the financial impact of the shelter in place and the impact of COVID. So we didn't want to continue with what we had initially thought we were going to do based on knowing that there would be a financial impact. So that's caused some of the delays as we've been really trying to figure out what is the landscape going to look like over the next couple of years to make sure that our plan is reflective of that, so we're not constantly having to change and adapt that plan. So what we're going to go over here today is a little bit about what we heard from the community forums, from the key informant interviews, the surveys, give you a little breakdown of how COVID has impacted, like I shared, let you know what to anticipate in the plan when it's posted, and then let you guys know what are the next steps in getting this plan approved. So we did 21 forums, as we said, in person. We did 4 virtual, and those were virtual forums last December, which was long before any of us became really well versed in using technology and virtual meetings. But I think we came away from those with successful efforts. We did 21 key informant interviews. Our key informant interviews were primarily individuals who were not involved in the behavioral health system. There were some community partners, some advocates, but we wanted to really be able to get a broader input and hear from others as well. So those included elected officials, included community leaders, faith leaders, etc. We had over 700 surveys that were utilized in that process as well. And then we also looked at any other feedback opportunities, and we've been, since that time, including and incorporating feedback that we're hearing, whether it's through our FSP evaluation, whether it's through some of the other project evaluation, to help inform our process. So real quickly, we do have listed on there the 14 themes that really emerged from all of those forums and those community surveys. If you look on there, there are a number of them. Those were in the order based on how many times we heard them or where they seem to kind of continue to pop up. Some of the themes in there, some of the specific requests were things that people shared with us that we did write down, but they may not fit always into the scope of the MHSA plan, but we did record them. There were some new ideas that had to be adjusted or being adjusted due to the impact that COVID-19 has on our MHSA funds, which I'll discuss a little bit more in the later slides. Item 1, for example, was going to have some challenges with funding because that sometimes means adding positions, adding programs, which right now would be somewhat of a challenge, which I'll explain a little bit in terms of impact of COVID. But we have been able to engage with utilizing some wet dollars, putting up a match, and being able to get some state wet funding match. That's going to allow us to actually do some work. And some of that work is going to address number 1, but it's also going to address number 9, the theme that you see in terms of career pathways, and really addressing that mental health shortage that we have in Fresno, in the central region, need for bilingual, bicultural, lived experience, and really having individuals that are providing services in our system of care that better represent our communities. So, 1 and 9 are actually going to be items that will hopefully be addressed through our upcoming efforts in this plan with our wet dollars. Items 2 and 4 really revolving around outreach and training and stigma reduction are things that are ongoing and we have been doing. So the use of the social media, the platforms that you're viewing this on today are some of the platforms that we've utilized to do that outreach and engagement pre-COVID and since COVID. So you can go back and look at some of our other posts, videos, things like that on here. You'll find efforts around outreach. Like theme number 7 is being addressed through one of our innovation plans, as well as some work outside of MHSA to try to improve transportation. So those are not necessarily things that have to be an MHSA funded effort. Those are opportunities for us to work with the Fresno area transit, rural transit, and just other resources to see what we can do to improve access through transportation. But we did hear that as an item, and so one part of it is being addressed in our program. The other part is being addressed hopefully through some, well, not hopefully, but we'll be addressing through some of our other options. And then through the COVID, impact of COVID, we've realized and improved and gained greater knowledge in terms of using telehealth. So telehealth has been a great tool to try to curb and address some of those transportation barriers, but we still do need to address and improve on overall physical access to certain resources. So those are things we're looking at. If you look on there in terms of addressing the need for peers and peer inclusion, last year in May, we had 3 innovation plans that were approved. All 3 of those innovation plans had peer components to increase our peer workforce. And moving forward, we're doing our best we can to include peers in as many of our programs and services as possible. As well as the recent passage of Senate Bill 803, we hope will also increase opportunities for peer involvement, not just in our programs, but throughout our entire system of care. Some of the other things that were brought up in their themes as far as assisted outpatient treatment will be something that'll be reviewed. We're not sure if it'll be something that will come or be driven by MHSA, just because, again, the limited funding we're facing right now, and actually the reduction in our MHSA funding over the next couple of years, do make starting up new programs somewhat challenging. But it is something that we heard that we are looking at, and we've been exploring options and how that could be utilized in terms of completing the continuum of care, as well as maybe aligning with some of our other projects like our Psychiatric Advanced Directive, as well as our FSPs and some of those other things. And then, we do have, there was a request in a couple of forums around more support for justice-involved individuals. And we do have currently, and again, we didn't go through every program that the county has currently, because we would have spent more than half the meeting just listing programs we have. But we do have several full-service partnerships that are geared towards specifically individuals involved in the justice system. We have several collaborative courts that are funded through MHSA that looked at supporting both adults and youth involved in the justice system. as well as looking at some additional projects, which we'll talk about future, a justice map that we hope to also be able to support justice-involved individuals. So you may not have seen us putting forth a new program per se on some of these areas, but that may have been in part because either there's limits to what we're able to do right now financially, but more likely because we actually have a lot of other programs or services in place that we are using and leveraging to address some of those areas that you guys all brought up. So the COVID-19 impact on our MHSA 3-year plan. It definitely did create a lot of delays in our ability to complete the plan as we had intended in May of last year. So at this point, we're about 6 months behind on our plan, but we did get a formal approval extension from the California Department of Healthcare Services to allow us to complete this planning. We've been working on this planning steadily, and really our biggest delay has not been around your guys' input or addressing needs or looking at the needs assessments, but as I had mentioned, is looking at how do we financially make these programs viable. So our focus is really on trying to sustain some of our current programs. We're looking at what we can do in terms of utilizing some of our innovation to come up with a couple of new projects, because innovation funding can only be utilized for some specific projects. So we're looking at how we could leverage that. We're going to be evaluating and assessing every one of our MHSA funded programs to really look at what are programs that could be leveraging and utilizing Medi-Cal billing. Are there places that we are not fully maximizing, other revenues? We're looking at, if there's programs that we were looking to bring in online that we just had not brought online, not eliminating from our plan, but maybe putting a freeze on them until such time that we, find that those programs would be viable and sustainable. We also don't want to start a program and then have to end the program 2 years later, 3 years later, because we're not able to sustain it. So we're looking at those things, looking at delaying some RFPs, like I said, until we know that we can launch those programs and sustain them. We're looking at trying to keep programs at their current levels. So a lot of our vendors and contractors have heard that language from us that we're not increasing contract budget amounts each year. We are keeping those at a freeze as a way to try to ride out the storm that we're facing. And we're looking at sunsetting some programs. Those are programs that either just have not been fully utilized during the past 3 years, programs that maybe had been presented, but in the time since they were introduced to now have not come to fruition. And there's other resources now in the community. Just reminding that MHSA is intended to be a funding source of last option. It should not be duplicating a service, should not be the first option. So a lot of time where we've been able to find other resources that can address that need, we're utilizing those. And then there's programs that through utilizing a third-party evaluation process we're looking at, and if the programs just are not able to produce the outcomes that either produce outcomes or demonstrate they're producing certain outcomes as required by the PEI regs, prevention early intervention regs, those may be some programs that are sunsetting as well. So you'll see those are called out specifically in our MHSA plan. I do want to remind everyone that MHSA, the Mental Service Act, is funded by a 1% tax on annual incomes over $1 million. So when the economy takes a significant hit, that means that future revenues are going to be taking a hit on that as well. So we're looking at, over the next 3 years, a drop in the area of 12 to $16 million. That's starting with this current year over the next year. So as our revenues are kind of dropping down, it would not make sense for us to try to increase costs and add new programs, because we would not have a way to fund them or really sustain them long term. So that's where you'll see in the plan where we specifically have identified programs that we're keeping, programs that we're looking to redesign and maybe leverage, programs that we're looking to sunset or retire. And then there's a couple of new programs that may be coming on board, but those are because of different funding source. So WET, we were able to put up about, it was a 2-to-1 match, so we put up $300,000, but we're able to get about $600,000 back. So we got that money back plus that additional $600,000. So for $300,000, we were able to now do $900,000 of workforce education and training. Similarly with innovation, that money set aside and can only be utilized for innovation. There was questions earlier this summer of if the legislature would allow some reprieve on that during this time. That was something that was not approved. So innovation funds can only be utilized for innovation. and so we'll be moving forward with those. But we're really trying to limit adding new programs. And like I said, within MHSA, there are some different funding categories. There are 5 actual funding categories, and most of the money that are in those funding categories remain in there. There are a couple CSS and PEI that you can move back and forth, or move some funds out of CSS into other areas, but we're not looking at trying to establish or create more programs at this point, again, with the concern of being able to sustain them long term. And then, like I said, we're looking at, where can we be more efficient with our programs? Are there programs where we could be leveraging Medi-Cal or FFP, as we call it, and we haven't been, or maybe we haven't been doing it as well, and looking at what we can do to address that so that we can bring in other revenues until such time that we hopefully see a stabilization and then an uptake of some of our MHSA funding. So what to expect in our plan, I shared that a little bit in there. We did process the community input. We are trying to limit growth and limit program, as well as limit program reduction. So what we're trying to do is not just eliminate a whole bunch of programs. We're really trying to see what we can do to sustain programs, and that includes looking at where we can combine programs, leverage other resources, things of that sort. We're trying to approach all of our programs from a health equity lens, and understanding that there are health disparities, and looking at how we could really utilize MHSA programming to close those gaps and improve health equity. We're working to be more data-driven and data-informed. So really looking at outcomes, really looking at programs that meet needs, looking at where are the gaps in our system, and being informed by that data. And then lastly, focusing on sustainable strategic approach. So you won't see new programming for the most part in our 3-year plan outside of WET funded programs or innovation programs. Very limited growth, so most programs are not set for any kind of expansion. There is the option and possibility for programs that we've left in there from previous that have not been brought online or implemented yet, so that if things change, we definitely could bring those on, so we won't have to go back and write a new plan to add those. We've left some of those in there, but they're going to be held off until such time that we can sustain those. There are a couple programs that are set to sunset, and those are called out specifically in the plan. You'll see those. And some of the reasons for those are going to be detailed in there. Just wanting to clarify that MHSA funded programs are not a grant. Fresno does not utilize MHSA programs as grants. So we do not, some counties do award MHSA funded grants for certain projects. We do not at this time. That was a discussion in our community planning process of could we do something around mini grants that could allow some projects. Unfortunately, being in the red and potentially having that reduction of MHSA funding for the next couple of years really limited that as an option. But MHSA programs in general are not grants. So we're also looking at, what are actual costs of programs and making sure the budgets match those costs. We don't want vendors, in the last month of the fiscal year, all of a sudden spending a bunch of money on office supplies because they feel they have to spend it down to zero. It's not a use it or lose it. If that money is not utilized in that program at the end of the year, that allows us to then use that money to support another program, support another effort. So it really allows us to have a communal approach and really supporting the needs of our community by making sure that programs are matching their costs and not spending money just for the sake of spending down money. Because then it takes away really from other programs and services and resources or potential projects and needs in our community. So we are going to be looking at that more closely as well. And as we've noted, we're looking to really become more outcomes driven, focusing on health equity, really looking at sustainability of programs. We don't want to have a program that we establish and then we have to sunset it, a year later. So we're looking at can programs be around for the long haul, and then also looking at programs that maybe just are not meeting our needs anymore, not meeting the community needs. Do they need to be redesigned, or maybe we shift our attention to something else or another need in our community? And really our overall goal is to really use MHSA to be that, not just that transformational tool in our system of care, but also being able to help us leverage and help be basically the glue that binds our system into a more integrated system, because we can fill a lot of those gaps with MHSA. So just some new items that I had said that we would come to. Our MHSA efforts, the only things that you'll be seeing new are WET, and those are, the WET was part of the WET plan, and it was based on the criteria that OSHPAD gave us, the Office of State health planning, if I remember the exact acronym. And those are going to be utilized to drive career pathways and engagement. There will be opportunities for scholarships for students that are seeking careers in the public behavioral health field. There will be opportunities also for some loan repayment through those projects. And when we say the public behavioral health field, does not mean that they would have to work for the county, but if they're working for any of our contractors providing those services, they would also be eligible for those. So that is one thing that is new, that's added, that we did not have in the previous MHSA plan, just because those funds had finally been utilized over a 10 years span. We do have some MHSA innovation funding, which has to be specific funding for specific state-approved projects. Those are for 3 or 5 years. You don't get more money if you do 5 years. It's can you stretch the money for 3 years or for 5 years? The challenge with utilizing innovation funding is once your 3 years or 5 years are up, if it's a program that's viable and that you want to continue, you do have to find other ways to fund it. And again, we're looking at programs that could be sustainable in the future. We cannot add a number of innovation funded programs and then not be able to fund them. So those are really things that we're looking at. There's 3 projects that we're working on that we're seeking to have approved before June 30th. 2 of the 3 have been part of the past plan. So the suicide follow-up call program, that was something that was in our last annual update as a possible PEI program. It has not been brought to fruition, and so at this point we're looking at doing something different with that program that would make it innovative. So utilizing the follow-up call program for suicides, but really trying to use that follow-up engagement as a way to engage and get people involved in care, which is not the innovative part, but getting information on what was going on and what maybe led that person to that crisis moment that will help us better understand what is going on in the community with regards to suicide prevention, and hopefully inform us to be able to have more responsive and targeted efforts around prevention, and also intervene more effectively if we start to face clusters or contagion effects. The Justice Multi-Agency Access Point Program, or Justice MAP, was in our previous plan as an innovation plan. We had looked at moving it forward as a PEI plan. And then with the impact of COVID and really not being able to add programs in PEI, we're going to leave that as an innovation program. Our plan is to do something with that would be innovative, so not just taking money and doing a justice involved, but really looking at what are things that we could do differently with our justice populations that we have not done in the past to help divert people that have a behavioral health need, and that could include substance use, and getting them guided to those services differently than some of our diversion in some of our existing collaborative court programs. So that one is actually going to be hopefully a plan to plan. So we're looking at doing that in 2 phases, getting a plan together that would spend a year with having stakeholders such as yourself, whether they're from the justice sector, whether they're from the healthcare sector, housing sector, individuals with lived experience, the behavioral health sector, individuals who are currently involved with the justice system, and really getting some input into designing a program that will be most effective in addressing the needs of that population and then implementing that. And the third one is one that is new, that was not in our previous plan. In our MHSA plan, it makes references to exploring that, but we have an opportunity to work with that through our innovation, and that is the California Reducing Disparities Project Evolutions. The California Reducing Disparities Project, Phase 2, also known as CDIPS, Community Defined Evidence-Based Practices, were a series of MHSA-funded projects by the State Department of Public Health. So they were not locally funded projects. They were state-funded projects that required to have an evaluation component to really measure and assess could some community-defined programs really address some of those behavioral health needs in our communities that are specific to populations that don't use what we would say in terms of our normal government approach or evidence-based approach to services. There are 3 of those programs here in Fresno County that have been operating. Those programs are set to end their funding at the end of this year, and our hope is to, through innovation, pick up and continue funding those programs, but really looking at what are some things that we can do with community input and those providers' input that could slightly adapt those programs to make them align better with some of the MHSA regulations and how counties fund programs, so that those programs could in the future continue to be viable, sustainable programs utilizing other funding as their state funding sunsets. And so that's a project that we're also looking at adding. So that'll be something new, but again, it's under our innovation. It'll give us a chance to really test and see if that works. And that's the same thing with all three of those. It's really testing and seeing if they work. They're heavily based on evaluations and outcomes and looking at design. And if those don't work, then at the end of 3 years, we know not to continue to spend money on something that's not working, but be able to shift our attention to elsewhere. And if they're working, part of that strategy then is to look at how do we sustain those. Oh, why is it doing that? Sorry. So next steps. The next steps we have is to complete these sessions. We do have another one, 2 on Thursday, one in Hmong at noon, I believe. We have one at 5 o'clock on Thursday, again, this coming Thursday. And then there'll be one in Spanish on Friday. After that time, we're working as quickly as we can to get the plans finalized so that they can be posted. They'll be posted for 30-day public comment. One of the things that we do want to notice is when we post those, we'll put notices out on all our social media pages, but you'll also be able to find the full plans on the MHSA, on our MHSA page, which is just www.mhsafresno.com. Is it .com or .org, Brian? .com. So we'll be posting that there, so that way you can look at it. They are going to be large because this will include our new 3-year plan as well as the annual update or wrap up from last year. So combined, you're looking at it, it'll probably be a 200 plus page document. So I warn people, it's best to review it electronically and maybe only print specific sections you're looking for than to really try to print 200 some odd pages. Some of it are maybe things that are redundant in terms of budgets and things like that. If there's specific program things you're looking at, you know, identify those if it's the annual update, or if there's new items, maybe just pulling those sections out and looking at them. We don't really have a way of segmenting those. We will have them broken down by tabs in chapters to make it easier for you to identify those, but we have to submit a plan. We can't post sections of plans when we're ready for the 3-year plan. We'll have the 30-day public comment period, which will be able to take some additional feedback from our community. We'll have a public hearing. We're looking at possibly having 3 public hearings, one that would be in English, potentially to coincide with our Behavioral Health Board. We'll see if those align. But we will also do an additional public hearing in Hmong and Spanish, and it'll probably be done virtually because at this point in January, we don't foresee us returning to in-person activities. So those will be opportunities for everyone to be heard, have input, but it'll be similar to what we covered today. There may be just some additional updates, but pretty much what you're hearing today on these follow-up sessions we wanted to do is what you would hear in those public hearings, with the exception of maybe 1 or 2 additional feedback. What we did want to do is give you a chance to really have time to think, hear, know what you're going to be looking at when you go review the plans, and so when you come to the public hearing, it's not the first time that you're getting the information, and so really making sure that we're as transparent as possible.
It's FresnoMHSA.com.
It's FresnoMHSA.com, and actually on the next slide, it'll have the correct web address on there as well. So FresnoMHSA.com is where you'll be able to go view the flyers posted for the rest of the dates for these hearings, and the plan will also be posted over there for your review, as well as any information on when and where the public hearings will occur. Back to this particular slide, once we have the public hearing done, we will be submitting this plan to our Board of Supervisors. Once it's approved by the Board of Supervisors, it gets submitted to both the Department of Healthcare Services and the Mental Health Services Oversight and Accountability Commission, and then we start moving forward, and we'll have authority with that plan. Right when that's done, we're going to start working on an annual update again, so it is kind of an ongoing cycle. But the good thing with that is it allows us to really be able to adapt and adjust to the changing landscape and a lot of the things that we're experiencing with COVID and how it's impacting our economy and thus our MHSA. Yeah, when I was one of the things I want to make sure when I say this year, we're referring to fiscal years always, not calendar years. So when I say the reduction in MHSA funding starts for this year, the plan includes this current year, it's fiscal year. So that means from July 1 of 2020 through June 30th of 2021, not the end of this month. So just wanted to clarify that if there's any questions. If you guys see on this last slide, we do have information on there. If you have comments, questions, any concerns, you can email us at mhsa@fresnocountyca.gov. We will provide a response to you as best as we can if we are able to answer the question. If there's some reason why we can't answer the question, we'll still respond to you and try to see if we can direct you or guide you to getting the answer that you need. Also, the website that Brian and I were just discussing, www.mhsafresno.com. That is a county website. It's flipped. Oh, well, we need to update that slide then. So it's Fresno, MHSA.com. That's just a URL that makes it easy for you to find that page on the county's website. If you go to the Fresno County DBH website under MHSA, you'll find that same info as well. It's just a lot more difficult to find because you're having to go to the county website /behavioral health / all those other things, versus if you just do www.fresnomhsa.com, does not matter capitalized or lower, just fresnomhsa.com. It'll bring you directly to the page where all those resources and information is. And if this is your first time hearing about MHSA or engaging, there's some videos and content on our on our website as well, on that fresnomhsa.com, which will explain to you the different components of MHSA, what the process is. You can find some of the previous plans and projects as well. I'm going to check now with some of our staff that's supporting us remotely to see if there's any, if they've received any questions with regard to our public comments. Well, I don't say public comments. Our feedback session here right now, if there's any specific questions. And if you have questions later or something pops into your head, you absolutely can email us at that MHSA@FresnoCountyCA.gov address. We'll try to respond within a day or two, the best we can. And understand this is not your only chance to do this. We will have some additional, like I said, feedback sessions. There will be the plan, the full plan will eventually be posted. You'll have 30 days to review it, provide public comment, as well as some public hearings. We are warning you ahead of time. The plans are large, they're long, they're lengthy. Those are the things that we have to do. Those are not our choices or options. Those are things that we're required to include in those plans in order for them to address all the requirements. So I know people sometimes say that those plans are long to read, and I say, touche, because they're long to write. Because I think the annual update is 20 some odd pages. The current plan right now sits at about 140 pages. Myself and my team have been working on those. So yeah, they're definitely long to write. They're long to read. They're long to edit. So what we're going to do this time around is really do our best to try to have those things sectioned off, provide a table of content, so that it makes it easier for you to just flip these specific sections if there's specific things that you're looking for in those plans. As of right now, it doesn't seem to be that there's any comments or questions on either the Facebook or the YouTube. So we'll give it just another minute or two and just see if we get any. I'm also checking Facebook to see if anyone has any comments, so that's what I am doing. Just to see if there's any comments or anything before we close out. And again, you have the opportunity to email us. This will be up on both YouTube and our Facebook page, so you'll be able to go back and watch it. You can let people know, hey, if they didn't get a chance and they wanted to participate, they can go back and watch this, see if they have questions, email us. And again, there will also be the one on Thursday at 5 o'clock as well on the same platforms that'll be covering pretty much the same information again. We'll give it another minute or so and then we'll wrap it up. we'll give it one more. So once we hit 5:35, we'll go ahead and log off. But like I said, this will be up and available. You'll be able to view it on Facebook, on YouTube, and then we will have the same one in Hmong on Thursday at noon. It'll be myself kind of doing the same presentation with an interpreter who will be speaking for those that are listening in Hmong, and then we'll have a second English one on Thursday at 5, and then a Spanish one on Friday, and all that information can be found at let me make sure we give you the right website again. Or URL. So it's Fresno, MHSA.com. Just type that in. It'll bring you to the county page. It's just basically a shortcut, and you can find all the information on upcoming meetings, when the plans are posted, public hearings, anything like that on there. All right. With that said, we're going to say good evening to all of you out there in Fresno and in Fresno County, and we'll check back in with you on Thursday. Good night.